My name is Rosalind Marshall, and my proposition is whole grain is a compound that is essential to good health. The Encarta Dictionary states that the definition for biochemistry, its use of essential means that it is a nutrient that is not made by the body, but is required therefore through diet. According to Professor Dr. Joanne Slavin of the University of Minnesota, whole grain benefits have been known since the 4th century. My claim to you is that whole grains are crucial to our health because they are a single food product from which come multiple health benefits. My claims are they are natural and provide many vital nutrients, they help prevent chronic diseases, and they promote weight management. My first supporting claim is whole grains are natural and they're whole. Whole grain product is an unprocessed product, and it's whole. This means that it contains the whole kernel, which consists of 3 vital parts: the bran, the germ, and the endosperm. The bran and germ are 95% of where the nutrients come. When grain is refined or processed, the bran and the germ are removed, and this allows for a 75% loss in many of the vital nutrients, including fiber and vitamins and minerals. This is according to Dr. Donald R. Davis, a senior scientist. Due to the large consumption of Americans eating refined grains, the government has instituted guidelines that require whole grains to be nutritionally fortified with folic acid, thiamine, riboflavin, niacin, and iron. This is per the Dietary Guidelines Advisory Committee. Even though they are enriched in this way, there's no way of replacing all the vitamins and minerals, nor is it able to replace any of the fiber. And this is per the USDA's publication, U.S. Agriculture, Linking Consumers and Producers. So as you can see, refined flour is nutritionally insufficient, and therefore it is inferior to whole grain. According to Dr. Donald R. Davis, the Food and Nutrition Board finds whole grain to be a desirable food product because it is intact with all the fiber as well as the vital nutrients, including vitamins like A, B12, C, and D, as well as essential amino acids. Dr. Davis also states that whole grains contain significant amounts of 21 or more nutrients, and that is based on wheat. Dr. Joanne Slavin states that consumers of whole grains have a significantly better nutrient profile than people who do not consume whole grains. Claim number 2, whole grains help prevent chronic diseases. 90 million Americans are affected by health concerns that compromise their quality of life as well as their well-being, and this is according to the 2005 DGAC Committee's advisory report. They also state that one of the major causes of morbidity and mortality in the U.S. is poor diet. But they have found through research that whole grains are able to reduce the risk of major diseases like cardiovascular disease, including coronary heart disease, as well as diabetes. Dr. Joanne Slavin, who is also a nutritionist, has performed an analysis of dozens of whole grain studies that conclude that whole grain consumption can reduce the risk of many diseases. Dr. Jennifer A. Nettleson, professor of epidemiology and disease control at the University of Texas, headed a joint study between the University of North Carolina and the University of Minnesota that followed 14,000 people over a 13-year period, and they found that whole grain helped lower heart failure risk. Researchers led by doctor and nutritionist Tanya Agers-Collins of the U.S. National Cancer Institute concluded that a balanced diet, including whole grains, cut the risk of breast cancer. The Los Angeles Public Health Agency states that healthy diets, which include whole grains, are effective medicine for those with prediabetes. And what prediabetes is, it's the condition where the blood sugar levels are elevated, and this can lead to diabetes if it's left unchecked. An 18-year-long study by the Harvard Medical School led by Alan Flint, a research scientist, found that whole grain diet contributed to a 19% reduction in the risk of high blood pressure and a 15% reduction in hypertension. Claim number 3, consumption of whole grain promotes weight management. The National Institute of Diabetes and Digestive and Kidney Disease, an agency under the National Institute of Health, reported in 2001 that obesity among adults had doubled actually since 1980, and among adolescents it had tripled. Currently, 1/3 of adults over 20 are overweight. Many weight reduction programs are not able to produce sustained weight loss, and this is a major concern for the LA Public Health Department. A poor diet has been attributed to energy imbalance. It's a condition that arises when too many calories are consumed and not enough energy is expended. This leads to an increase in weight as well as obesity. The government agencies, the DGAC and the USDA, have stated that overeating can be reduced, energy needs can be met, and weight can be managed through a balanced diet that includes whole grains. Dr. Kathleen Melanson at the University of Rhode Island and her team of researchers validated this claim when 180 of their test subjects lost weight over a 6-month period eating a diet that included whole grains. It was successful because the fibrous constitution of the grain slowed down consumption, causing satiety over a longer period of time, and thus hunger was delayed. Researchers at the UCLA, headed by Dr. James Bernard, found that whole grain foods work as an appetite suppressant. There were children from 9 to 15 that they put on an all-you-can-eat diet that included whole grains, and in 2 weeks, the leptin, which is a hormone that affects appetite, fell an average of 57%. In closing, I want to quote registered dietitian Dr. Chris Moore, who says that Americans are overfed yet undernourished, and that by getting the right nutrients, they can truly impact their health. I hope you will therefore accept my claim that whole grains are essential to good health, and it's based upon their beneficial qualities, which include the fact that they're natural, that they have rich vitamins and nutrients, that they're able to prevent chronic diseases, and that they are able to help you maintain your weight. Thank you.
All right, Rosalind, you've got a good citation of your authorities, consistent quotes, lots of good statistical information. I think you need some better numbers on that third point. There's only one study that actually quantifies the impact on the second point. A lot of the rest of the arguments say it lowers, it decreases, it has an impact, or a diet that includes whole grains has a benefit, but the total amount I think is a little bit problematic. Signposting on the proposition and the supporting points is good, so that's easy to follow, and you're very good at citing all of the sources in the presentation. I'm just not exactly sure what the controversy is. If we've known the benefits of whole grains since the 4th century, who's in doubt about what the potential benefits are? This sounds like it's an informative speech. Now, there might be some dispute, for instance, over how big a part of the diet whole grains need to be, or, for instance, for what reasons we are not getting an adequate amount of whole grains, and I think that's where that controversy needs to be developed a little bit more. All right, thank you.